This was a 38-year-old guy, came in with swelling around the groin area. So these are just seen images through the testicle and the epi, and I'll just run through them first. So the testicle itself was okay, the epi was okay, we did color images. Where his concern was just above the scrotum, sort of in the inguinal canal area. And then we have a long view of this and trans view of the same thing. And on color Doppler, this did not show a whole lot of vascularity. I couldn't include those images because on ultrasound, somehow I cannot crop the patient's name. So I cannot show you static images. But any thoughts based on this?
So you're saying it was separate from the scrotum?
It's separate from the testicle.
Mm-hmm.
The epi is over here. The testicle is over here. So this is completely extra testicular. It's somewhere superior to the actual scrotal contents. So that's why they labeled it groin.
And it did have vascularity?
It did not have much vascularity.
Okay. Anu was asking, is there a normal testicle on that side? Which I think there was, because you're saying separate from the normal testicle.
Yeah, both testicles were normal. Right and left were both normal vascularity. Epi was fine. And this had been a slightly slowly growing mass for the past 6 months. The history was 6 months long. And maybe I should show you guys static images for this imaging finding to be seen better. Let me.
Somebody's asking.
Okay, say that again.
Can it be an epidermoid?
Okay. Why do you say that, Amar?
The world, like usually we see them as like a typical world appearance.
Okay.
So either a it's just like an epidermoid elsewhere in the dermis. That's one thought, or maybe there was some testicular tissue, and then that's kind of a wild thought. But the world appearance is that's what makes me think.
I think you got it. I think the static images show it so much better. So this is what they call a typical onion skinning or onion peel-like appearance, right? Concentric alternating layers of hypo and hyper echogenicity, like the cut surface of an onion, and then minimal to no vascularity internally. So this was actually an extra testicular epidermal inclusion cyst. We were commonly used to seeing the intratesticular ones, which they say is like a monomorphic form of germ cell tumor. But this was an extra testicular one just outside the scrotum in the inguinal area, very closely associated with the skin. And the reason you get this ultrasound appearance is because of the keratin and the cholesterol and the debris, which creates these swirly interfaces where the beam goes back and forth. So you get that very typical world or this onion peel-like appearance. Just like epidermoids anywhere, it's a traumatic implantation. These can be intratesticular. Those are the ones we're more familiar. And like any epidermal inclusion cysts, these can be diffusion restricting and T1 hyperintense. They can get infected, they can rupture. Very rarely, they can turn into squamous cell cancers. So just a few images from the literature of the classic ones we see, the intratesticular ones. So this is intratesticular and the same thing on MR. Sometimes it can have what they call a targetoid appearance also, but on ultrasound, the classic one they talk about is this lamellated appearance. So just 2 quick scrotal cases.
That's a great job, Amar. I didn't even cross my radar, but yeah, like you're saying, it's lamellated. That's awesome.
Yeah, and then this is a nice, relatively new article I found where they talk about how MR helps in characterizing extratesticular masses. So these are the common other differentials we think about. And it takes us through how MRI signal characteristics help in differentiating some of these. Adenomatoid is the one we see much more commonly in the epididymis itself. So this wouldn't be outside. This would still be very closely associated with either the tunica albuginea or the epididymis itself. But that's typically low in signal compared to these ones, which are T2 bright. That's all I have. Can you take control